You're sitting on your couch, scrolling your phone. Nothing bad is happening, but suddenly your heart races, your chest tightens, and a strange wave of fear or uneasiness washes over you. It feels like anxiety came out of nowhere, no argument, no bad news, no real danger. This moment is familiar to many people. It raises the question, is your body just broken? The short, reassuring answer is no. Your brain and body are doing something very old and very human, just a little too strongly and too quickly. Anxiety isn't just in your head. It's a real body and brain response designed to protect you. Picture walking alone at night and hearing fast footsteps behind you. Your brain flags possible danger and in a split second flips on the fight or flight system. That system speeds your heart, makes you breathe faster, sends blood to your muscles, and sharpens your senses. It's brilliant when you really need it. But sometimes that same system turns on when there is no real threat. And that's when you feel a sudden rush of anxiety for what seems like no reason. Inside your brain, there's a tiny structure called the amygdala. Think of it as an internal smoke alarm. Its job is to detect danger as fast as possible. When the amygdala senses something might be wrong, it sends an urgent message to the rest of the brain and body, get ready, something might be bad. That message activates the autonomic nervous system, especially the sympathetic branch that drives fight or flight. Meanwhile, another part of your brain, the prefrontal cortex, the thinking area behind your forehead, tried to check the facts. Are we really in danger, or is this a false alarm? When you're rested and calm, the thinking part can quiet the alarm. When you're tired, stressed, or already on edge, the amygdala can overpower that rational voice. The alarm blasts even if there's no fire. So why does it feel so random? Often the triggers are real but not obvious. One hidden trigger is body sensations. Your brain constantly monitors your heartbeat, breathing, temperature, and gut. This is called interoception. A small change, a skipped heartbeat, a sudden deep breath, a little dizziness when you stand up, or too much caffeine can be misread as a serious problem. If your brain is sensitive to these signals, it might interpret them as something's wrong with me. That thought increases fear, fear increases adrenaline, and adrenaline increases the very sensations you're scared of. You get stuck in a fear symptom, more fear loop. From the outside, it looks like anxiety came out of nowhere. Inside, it started with one small sensation. Another hidden trigger is old memories and context. The brain links places, smells, sounds, and situations to past experiences, even ones you don't remember clearly. Maybe a supermarket once hosted a panic-like episode, or a car ride felt particularly alarming before an exam. Later, being in a similar place or situation can quietly wake that memory. The amygdala recognizes the pattern and pulls the alarm before you consciously realize why. This explains why certain everyday settings can suddenly feel threatening without an obvious cause. Chronic stress is a third hidden trigger. When daily life is heavy with deadlines, conflict, or lack of sleep, the body's alarm system never fully powers down and runs on a higher baseline. In that heightened state, it takes very little, a random thought, a minor sensation, a small worry, to push you into an anxiety surge. Your nervous system becomes primed for alarm, and those sudden rushes appear more often. Sometimes the rush is more than mild anxiety. It can escalate into a panic attack. Panic attacks bring pounding heart, shortness of breath, chest discomfort, shaking, feelings of unreality or detachment, and intense fear of losing control or dying. They often peak within minutes and can happen anywhere. A mall, in bed, at work. Many people describe them as coming out of the blue. If these attacks recur and you begin to live in fear of the next one, clinicians call this panic disorder. It's not a personal weakness, it's a treatable condition rooted in sensitive alarm circuits in the brain. A single rush of anxiety now and then can be part of normal life. But it's time to see a doctor or mental health professional if it happens frequently, gets worse, causes you to avoid places or activities, or comes with red flag symptoms like chest pain, severe shortness of breath, fainting, or thoughts of harming yourself. The good news is, help exists and it works. Effective approaches include education, understanding that these sensations come from an overactive alarm system, not from going crazy. Cognitive behavioral therapy, or CBT, helps you challenge catastrophic thoughts and gradually face the sensations and situations you fear. So your brain learns that discomfort doesn't equal danger. Breathing and grounding techniques, slow, steady breaths, pressing your feet into the floor, naming what you can see, hear, and touch, help calm the nervous system in the moment. When appropriate medication prescribed by a professional, such as certain antidepressants, can lower the sensitivity of the alarm circuit over time. That sudden rush of anxiety for no reason is usually your brain and body trying, sometimes clumsily, to protect you. An over-alert alarm, A misread body signal, a triggered memory, or months of stress can all flip the switch. You are not weak, nor are you broken. Your system is firing too easily, and it can be retrained. Understanding what's happening inside you is the first step toward taking back control from those sudden waves of fear.